Hi, today we continue to discuss the INBDE exam, and today we will solve the 10 tests about the movable denture. In the end of every test, I will explain you why is that answer is true. But before that, I want to talk with you about my thoughts. I think that every field of our life we have to achieve the perfection. If you are a musician, you should conquer the whole with your playing. If you are an artist, your paintings would excite the people. If you are a dentist, you have to be the best one. You will ask me how it will help us. While we are learning the exam, we pay attention to every nuance, every fact. And even you are the practical dentist, this exam preparation will help you in your practical life. And this test will help you to study and strengthen your knowledges which you have. So I want to add to our videos some practices of my life, which my experience in clinic. After these thoughts, I understood that I have to buy new camera or phone for that videos, for doing the best videos, the good quality, and I decided to buy the iPhone Pro Max. So I decided to buy iPhone 12 Pro Max. Why the iPhone 12 Pro Max? Because it's have the very good camera. It's very prestigious, and I have received many recommendations from my friends. So I have bought the iPhone 12. Now about the dentistry, I want to talk with you about the clinical case. Patient with partial dentia. We have prepared for her acrylic-free denture, partial denture, and it was last visit yesterday, and I was teaching her how to put it and pull out the dentures. While she was putting out the denture, she had broken the attachment. There were cracked of attachment, and the problem is that she pulled by the finger in the molars, in the region of molars, and pulled the denture in the back side, and because of that there were overpressure in the region of attachment, and was cracked the attachment. So be careful, teach your patient very carefully. And occlusal rims are used to determine and establish the vertical dimension of occlusion, make maxillomandibular jaw records, establish and locate the future position of the artificial teeth. Acrylic resin used to denture repair should be under 20-30 psi air pressure while being processed to help eliminate porosities. When the repeat elevation in temperature causing evaporation of the liquid and vapor is then trapped as a gas bubbles. And porosities will also occur if packing and processing of the powder and liquid resin is too plastic. Other drawbacks: increased post-insertion care, increased post-delivery soreness, greater complexity of clinical procedures, higher total cost of treatment. The face bone transfer is maximum mandibular record. This is false. It is a record used to orient the maxillary cast to hinge axis on the articular. The posterior palatal seal is completed before the final arrangement of the posterior teeth because this final arrangement is laboratory procedure and is done in the absence of patient. Landmarks of posterior palatal seal is posterior outline formed by a line or vibrating line and passes through two pterygomandibular or hamular notches and is close to fovea palatini. The anterior outline formed by the blow line and located distal extent of the hard palate. The prognatic appearance is associated with the edentulous state. Soldering is used in dentistry to connect bridge work and in fabrication orthodontic appliances. The main symptom will almost always be when the vertical fracture, pain when biting. The radiograph usually appears normal. Other contradictions of porcelain veneer include traumatic occlusal contact, unfavorable morphology, insufficient tooth structure, and insufficient enamel.